leaders across the mid-state have said over and over again that they desperately need money for mental health services. Now, two bills in the state legislature aim to fill that funding gap. Would it be enough? Sonica Bargo joins us now with how the counties are answering that. Sonica.
Alicia, the short answer is no. Counties are short millions of dollars. But Dauphin County's mental health director says at this point, every little bit helps.
As a social worker of 46 years,
over a decades-long career,
I really think we're at an impasse in human services at this moment.
Dauphin County Mental Health Administrator Andrea Kepler has only seen the need grow.
So we have a tremendous demand for services.
Over the last 10 years, the need for services in children and teens has more than doubled. It's up 70% for seniors, but funding hasn't kept up.
They've been ignored essentially from a funding standpoint for over a decade, and that needs to stop.
Kepler says Dauphin County is facing a $1.5 million deficit, money they need
just to continue to function, to do what they've been providing.
Two bills are trying to help. One would set up long-term funding for the 988 Suicide and Crisis Lifeline. The other would distribute $100 million of federal money to mental health providers.
The need is so overwhelming. We hear about rates of mental illness that are skyrocketing across the board.
Democrat Mike Schlossberg wrote that second bill. He says the biggest chunk of that money should go to staffing.
We know that there are massive challenges within the mental health universe from a workforce perspective.
The problem, it's only a one-time payment.
But at this point in time, we are so much in need of funding support. Every little bit makes a difference.
Still, Kepler says it's not nearly enough. She says lawmakers need to think long-term, and Schlossberg agrees.
We need to do a lot more. I mean, frankly, this is a down payment, a drop in the bucket.
The problem is now so dire without more funding.
Dauphin County really is thinking that this is going to be the year where we're going to have to reduce services.
This isn't unique to Dauphin County. Cumberland and Perry County Mental Health Services are expecting a $2.5 million deficit in funding this year. And next week, Cumberland County Commissioners plan to sign a resolution calling for more money. In the newsroom, Sonica Bargo. Valerie, back to you.